Hi everybody, I'm Phillip Suderman, the Policy Director here with Americans for Prosperity Florida up here at the Capitol in Tallahassee. And of course, well actually not of course, we have a new person with us today, Skylar Zander, our State Director, Diego Echeverria, our Legislative Liaison, who's normally on these videos, had to take a quick break, but we got, in my opinion, an upgrade. We got the boss man himself. Skylar, how are you doing today?
It's great to be the much better looking Diego Echeverria, and it's an honor to be on today with you guys and to talk to all of you who are here watching.
Absolutely. Well, thank you so much for that. This is week 4 of our legislative update. Here to fill you in on some of the things that we're doing up here in Tallahassee during session for all of you back at home. So this week we had 25 different bills that we took in action on. In fact, I think that's actually our biggest legislative load yet so far. By the way, we scored nearly perfect on them, so that's great. We're really advancing, freedom and making sure that barriers to opportunity are broken down for the individual and community, including, by the way, 3 of our priority bills, all dealing with occupational licensing.
Phillip, tell us about them. I think I've been waiting for this update this week. I know our viewers have been waiting for this update, so talk to us about it.
Absolutely. So occupational licensing, if you haven't heard any of these other videos, it's something that we've been talking about a lot. But basically what it is, it's 30%, I believe, of Florida requires an occupational license just to do their job. And what that is it's literally a government permission slip. It can require hundreds of hours, thousands of dollars, exams, all of which are just, add to the cost of going through and trying just to do your darn job, right? So like I said, it's a permission slip really that you need to get from the government. Like I said, we had 3 of those up this week. 1336, this is being run by Senator Keith Perry. It's a bill that basically right now there are lots of municipalities and cities that add additional restrictions to occupational licenses above and beyond what the state requires. We are against this. We think that, hey, the state has already set forth the requirements for what is safe and what is useful. If you're just adding on additional requirements, those are just additional barriers to be able to get out and do your job. 474, which is a general dereg bill by Senator Ben Albritton. This is a bill that just kind of works across a number of different industries. It cuts down hours, it cuts down requirements in terms of pay, testing, just a little bit of different increments depending upon what industry it touches. This is something else that we're supportive of. And then, of course, on the House side, HB 707, which is being run by Representative Paul Renner. What this is, it calls for a legislative review of all of our occupational licenses, which is great because for a lot of them, they've been going on for decades. And every single year, it seems like you have another hour tacked on for this type of training, another hour tacked on for that type of training. And in a vacuum, all of these requirements might seem good or useful or helpful, but when you stack them all together, you get, for example, 1,200 hours just to be a barber, which is, in our minds, way, way, way too much. 1,200 hours, several $100s, you have to pass an exam, all just to be able to cut somebody's hair, which is what my mother was doing, I guess, illegally back when I was 5 and 6.
Yeah. Phillip, so you say 1,200 hours to cut your hair, and I know Patrick Mahomes, for instance, brought his barber down to Miami from Kansas City to cut his hair during the Super Bowl. Probably illegal based on Florida law, but the point of these occupational licensing laws are to make sure that the public is healthy and the public is safe. So are there professions that require license in true healthcare space and true healthcare occupations that may require less required hours or costs than becoming a barber?
Well, first off, let me say directly to the camera, Mr. Mahomes, I will never narc you out. You are my hero. Continue doing what you do in football, unlike my boss here, Skylar. But yes, to answer your question, there are medical professions that require far less. So, for example, to be an EMT, to be a nurse's assistant, can require a third to a quarter of the hours that it takes to become a barber. And these are people who are cleaning and taking care of patients. These are people who literally have your life in their hands, and they try to transport you safely from an accident or emergency site over through an ambulance over back to the medical facility or hospital. These are people who I think that we can all agree should require some training just to make sure that people's health and safety are being taken care of.
It's just amazing to me the restrictions that local governments are starting to put on people. Talk about, maybe for our viewers who aren't aware, Like, it's hard, especially in South Florida. We have contractors who go from the city of Miami or to the city of Fort Lauderdale, maybe. What are some of the restrictions, or what are some of the most erroneous licenses that you've seen in certain professions?
Well, I think there's so many to choose from, but certainly contractors is one of them. We'll hear testimony that building buildings in different areas require different codes and different things, and that's certainly true, but at the same time, it's such a restriction. If you were literally in the city of Miami and you go up north just a couple of miles sometimes, you can face totally different restrictions in terms of your licensing. This restricts your ability, by the way, not only to provide for yourself and grow your own business, this restricts your ability to provide for others. So it's not just the individual contractor that's being hurt, it's all of us. I can't go out and I can't call somebody who might live 4 or 5 miles away to come do a job because they're not licensed in my area, despite, by the way, being able to perfectly safely and perfectly correctly do their job back in their own area. But anyways, that's really kind of what's happening from a policy perspective up here in Florida. Just to give another quick recap, 25 bills, 3 priority. We're moving successfully on all of them, especially occupational licensing. But Skylar, one of the reasons why I wanted you to be on here today is there's so much more that happens from a state perspective than just our policy. And as state director, I think that you're in perfect position to be able to tell us what's going on out there. So what's happening out in the state?
Great. Well, thank you, Phillip. Look, we couldn't do anything or have the muscle that we have here in Tallahassee or have the conversations that we have with lawmakers without our activists, because at the end of the day, our activists are what make us successful and what give us the ability to come and have these tough conversations with lawmakers. And so our sister organization, Americans for Prosperity Foundation, brought over 400 students and parents all across the state up here to Tallahassee to talk about education freedom, what it's meant for them, and how it's transformed their lives. And so we're very fortunate that the state of Florida has been pressing their foot on the gas pedal and pushing forward on educational freedom. And we're going to continue to do so. And we were excited to have 300 to 400 activists here. There were so many, it was hard to keep track of how many were truly here, but the passion that they brought was absolutely incredible. And that's just one example. Americans for Prosperity has been focused on holding legislative roundtables across the state. We believe in a bottom-up approach, so listening to Floridians about the barriers that are really intruding in their lives and trying to figure out a way that we can bring them to Tallahassee and advocate. Or if they're not able to come to Tallahassee, you can attend one of our local town hall meetings like we did in Jacksonville this past week to have your concerns heard from some of our staff. And our staff are talking to us here in Tallahassee all the time about the issues that are affecting them the most. Additionally, occupational licensing is clearly one of our top priorities. Phillip talked about it earlier. Every week we're talking about occupational licensing. And this past week we held occupational licensing events all the way from Jacksonville to Miami, over to Tampa, all across the state, just educating everyday Floridians on how occupational licensing is a barrier to 30% of Floridians. That's a real number. That's a huge economic impact that we're finally having a robust conversation about. And I can tell you, Floridians are fired up. And I hope that everybody listening here will take the opportunity within the next 3 weeks to come up and join us for Freedom Tours. It's an opportunity where you get to see Phillip's shining, smiling face walking around the Capitol. You get to have those individual conversations with your members. We still have folks coming up from Miami. We still have folks coming over from Tampa. We're just excited that more folks are going to be joining us here, and putting them in contact with their lawmakers is our #1 priority. So that's what's going on in what I like to call real Florida, outside of the Tallahassee bubble.
Well, thank you so much for telling our activists and viewers back home about all that information. If any of this, by the way, interests you, I encourage you to continue following our Facebook page or Twitter page. Talk to our staff in various cities about how you might be able to get involved and be able to break down some of these barriers that are affecting individuals and communities, and to be able to let people really flourish. Once again, I'm Phillip Suderman, Policy Director. This is our State Director, Skylar Zander. Thanks so much for tuning in. We hope to talk to you soon. Have a great day.